Located at 5705 North Lincoln Avenue is a support center for the homeless known as Goldie's Place. Here, homeless people have the opportunity to utilize important services such as free dental care and job placement. People like Esther Lopez, clinical director of the dental care program at Goldie's Place, have a persistent mission that focuses around helping others, a mission that brings her service into the hands of the disadvantaged, a mission that has no signs of slowing down.
My passion has always been public health, and the reason for having a passion in public health is because I grew up in a very low-income household myself, and my mom passed away when I was 12 years old. She passed away with leukemia cancer, and I was her primary caretaker, interpreter when we would go out to seek medical care. And so at that age, I noticed how much my mom worked. I mean, she really literally worked herself to death. And it's difficult. I mean, now as an adult, I understand the entire number of issues that existed, barriers that were created that didn't allow for her to get the care that she needed. Right. We're talking about 1990, so we're much more advanced in treating leukemia now as we were back then.
Right.
But we still had a lot of doors shut in our face when we tried to get access to care. And for me, at 12 years old, for me that was a very unjust thing.
Absolutely.
And so at that age, I decided, that's not fair. I don't want people to be treated like my mom was treated. And so I vowed to myself in however immature way I did it, I vowed that I would help people who were in my mom's shoes. So time went on. My mom passed away, like I explained, when I was 12 years old. My dad fell into a very deep depression and left us. So it was my brother, my sister, and I. My sister at the time, my sister's about 8 years my senior, so she was older, and was able to carry on the household as much as she could. My brother was a teenager at the time. Like I said, we did as much as we could, but try to stay out of trouble. The teenagers, a 12-year-old, it's tough. Yeah. It was tough. We made it through. My dad, like I explained, left the house when I was about 16, 17, getting ready to go to college. We found him in the streets. So he had become homeless himself, was suffering from a lot of heart condition problems. Had him move back home to where we were staying before he left us, and I moved on to college. I'm making a much longer story, but in essence,
it's fine. Please,
the reason I got into dentistry is because I started off as someone who was interested in public health. Got my degree in biology, my bachelor's degree in biology. Went on to DePaul University, and I actually stayed there on board while I finished my degree. Went on to UIC School of Public Health. Started doing my graduate work there to get my master's in public health. At the time when I was going from undergrad to grad, my dad suffered a stroke, slowed things down a little bit for us. So I started going part-time. Worked as a university minister at DePaul University, which luckily provided housing, so I was able to bring my dad to live with me, and then he stayed there with me for 2 years. I was doing research at the grad school in public health, became involved in a dental project, saw the immense issues that existed in oral health care access in the state of Illinois and in the country in general. So just got connected that way. I did not apply to dental school until 2004. Things were really rocky in my own personal life. My dad passed away 2 years into me being in grad school. Could not finish grad school for several reasons. But then started dental school in 2004. Had to work within those 2 years, 2002 to 2004, to just kind of help pay for my dad's medical expenses that he had left behind. So I started dental school in 2004, fell in love with it. And when I do what I do here, it hits home. Every person I impact makes me feel like I've done good by my mom and my dad, because both of them, for one reason or another, and like I explained before, there's lots of things that exist and barriers to people getting access to care. But if I could be one small solution to helping an individual kind of, jump through those barriers, it makes me feel like I'm doing my job. The way that I became involved with Goldie's Place is that I was the founding student, one of the 5 founding students with the organization. the American Association of Public Health Dentistry student chapter that started the student-run dental clinic here at Goldie's Place. It's all kind of fallen into place. We've got a good supportive people, volunteers, and like I explained before, we've got our volunteer licensed professionals that are coming in, and we've got approximately 100 students, and that to me is phenomenal. I think it's great.
It's wonderful.
Yeah. I think it's great that we've got our licensed practitioners. These are individuals who have been in their careers for, I want to say, more than 5, 10, 20 years, each in different paths of their lives, which is great to have. We have 15 of them. One of them is an oral surgeon, and the 14 are general dentists, and then we've got 3 hygienists that also work with us. We have 4 clinic days. We could see 7 to 8 patients a day, about 28 to 30 a week. I know for me it was important that if we set up this clinic, it's got to be something that's comprehensive for our patients. What that means is to not just offer them simple extractions and just to fill the tooth, so, drill, fill, extract, and then that's it. I wanted to be able to provide these patients an opportunity to come to a nice clinic, a clinic that's pretty, that's sterile,
which it is,
with friendly people.
Right.
So we provide a lot more than just your typical extract, drill, and fill. We provide, comprehensive services for people who want to quit smoking. We provide them with nutritional information, preventive services like sealants and fluoride treatment or varnish placement so that they can avoid getting cavities. We do your typical fillings, so amalgam, that's the silver material or the composite. We do your cleanings, your deep cleanings, your superficial cleanings. We also provide dentures, prosthesis, and flippers. So if patients are, without teeth and can't eat, or are trying to get a job but find it very difficult because they don't have any teeth to present themselves with, we are able to now provide them with those free of charge to them. I truly do this because I have a sincere passion for helping people of low income. Whether I do it here or somewhere else, that's just where my heart is at. The best thing of working here is, like I explained before, just the gratification of seeing that, one less person is going through the struggles that my parents went through. And that to me is immenseful because I saw both of them suffer because of issues that existed or barriers that were there in them not being able to access adequate care. What motivates me the most is that those 100 students are being impacted. And this is why it's important to me because, number one, they see the faces of those individuals that are coming in for services. And number two, they see that the person who's the clinic director is someone who also walked the path, a very similar path to those individuals that are coming here to seek those services. And so they start to humanize all of the ugly things that they hear behind homelessness. And that to me is immenseful because even if they don't decide to do my type of services or my type of work in community dentistry, they will eventually in the future consider serving these types of individuals.